Hello everyone, I am Dr. Rajita. I am faculty of anatomy of NEXTFELLOW. So today's topic is on arterial supply of heart. So basically the heart is supplied by two arteries. They are called as coronary arteries. So there are two right and left coronary arteries which mainly supply the muscle of the heart called as myocardium of the heart. So here in this image we can see the two coronary arteries which are arising from the aorta supplying the heart. So we can see the right coronary artery very well appreciated, left which is partially seen, and immediately it divides into two branches. So these coronary arteries are vasa vasorum, means a blood vessel supplying a blood vessel, because embryologically the heart develops from dorsal aorta, that is the heart tube, and hence the heart itself is a modified blood vessel. So coronary arteries are considered as vasa vasorum. Let's talk about the origin of these coronary arteries. There are right and left coronary arteries. So the right coronary and left coronary artery, both these arteries gains its origin from the aorta. So we can see here, this is the ascending aorta which is related to pulmonary trunk. So what you are seeing is the cross section taken here showing the pulmonary trunk, ascending aorta and atrioventricular orifices, right and left atrioventricular orifices. So right coronary artery, if we talk about the origin of right coronary artery, it gains its origin from the anterior aortic sinus. So this is the anterior aortic sinus. You can see here, this is the semilunar valve, above to which there is a small blind dilatation which is called as aortic sinus. So anterior aortic sinus gives rise to right coronary. Left coronary artery, we have got two here posteriorly left and posteriorly right. So posterior left aortic sinus gives rise to left coronary artery, whereas the right posterior aortic sinus doesn't have any artery arising from it. So I just repeat, right coronary artery gains its origin from the anterior aortic sinus. Posterior aortic sinus, left posterior aortic sinus gives rise to left coronary arteries. So that was about the origin. So let's talk about the anterior coronary artery little more in detail. It arises from the anterior right anterior aortic sinus from the ascending aorta. So we can see here it is getting origin and it runs in the atrioventricular groove. This is the right atrium, here is the right ventricle. So this groove is called as right coronary sulcus. So it runs in the right coronary sulcus and we can see it winds round the inferior border of the heart to go in the posterior side. So posteriorly we can see the right coronary artery. Here is the right coronary artery. We can see this is the right atrium, this is the right ventricle, this is the opening of inferior vena cava and here is the opening of the superior vena cava. So the right coronary artery here, it continues and it gives branch here which is called as posterior interventricular artery. We can see here, and further it may terminate by communicating with the artery which is arising from the left coronary artery called as circumflex artery. So we can see a schematic view of here, the right coronary artery is descending down in the right coronary sulcus. It winds round the inferior border of the heart. After winding round, goes near the crux of the heart and it gives rise to posterior interventricular artery. So that is the course of right coronary artery. Let's talk about the branches of right coronary artery. Right coronary artery gives rise to ventricular branches. We can see here several ventricular branches supplying the right ventricle mainly, and also it gives rise to some SA nodal branches which supply to the SA node called as nodal artery, sino-arterial nodal artery, which is more commonly given off from the right coronary artery. And right posterior ventricular branches are also present, and one of the ventricular branches quite larger which is called as right marginal artery, and posterior interventricular branch which supply the posterior part of interventricular septum. So this runs in the posterior interventricular groove, well seen on the posterior side of the heart. The first ventricular ramus is called as the right conus artery, which is present here, given off in the beginning of the right coronary artery. So we can see here the right conus artery and the left conus artery. They anastomose with each other, forming an arterial ring called as Wiesen's arterial ring. It is an anastomotic channel, which is this anastomosis is usually present in front of the pulmonary trunk. So this is the pulmonary trunk. So around the infundibulum of the pulmonary trunk, the right conus artery and left conus artery forms Wiesen's arterial ring. And we can well appreciate the right coronary artery gaining its origin from the anterior aortic sinus, left coronary artery from the posterior left aortic sinus. Let's talk about coronary dominance, which is very important. So coronary dominance is determined by the posterior interventricular septum supply. So determined by the blood supply to the posterior interventricular septum. So this is the posterior interventricular groove. What you are seeing is the posterior view of the heart, and this is the left atrium, this is the right atrium. We can see the inferior vena cava opening, superior vena cava opening, and these are pulmonary veins opening into the left atrium. And this is the groove separating both the atria from the ventricles, and here is the groove which separates both right and left ventricles. So this is the right ventricle, this is the left ventricle. So the groove is called as posterior interventricular groove, and posterior interventricular artery is given off from the right coronary. 65% it is always given off from the right coronary artery, which runs in this posterior interventricular groove, which supplies posterior 1/3 of the interventricular septum. So coronary dominance is determined by the which artery supplies the posterior interventricular septum. So 65% the right cardiac dominance means 65% of the individuals will have posterior interventricular artery given off from the right coronary artery. 10% the posterior interventricular is given off from the left coronary artery. So it is called left dominance. And in 25% it is called co-cardiac dominance, means it is given off by both right and left coronary arteries. So that was about the right coronary artery and cardiac dominance. Next is the left coronary artery. Left coronary artery, we already saw its origin. It arises from the left posterior aortic sinus. So here is the left posterior aortic sinus. It has got a shorter course which immediately divides, and it supplies greater volume of myocardium because the left ventricle is quite thicker. So most of the left side is quite thicker, so it is myocardium is supplied by left coronary artery. So we can see greater volume of myocardium than right coronary artery is supplied by left coronary artery. So let's see its branches. So it has got a shorter course. We can see it divides into anterior interventricular artery and left circumflex artery. This is the left circumflex artery which is winding round going on to the left, and here is the anterior interventricular artery. Anterior interventricular artery, which is called anterior descending artery or left descending artery, it is a branch running between the two ventricles anteriorly, and it supplies 2/3 of the interventricular septum, anterior interventricular septum. Whereas the circumflex is the continuation of the left coronary artery. So the left coronary artery, the main continuation is the circumflex artery, which winds round along the left border of the heart to go on the posterior side, which is related to coronary sinus. Let's talk about area of distribution of right coronary artery. So it supplies right side, right atrium, right ventricle, except the adjoining part of interventricular groove. So for our easy understanding, So here is the interventricular septum. So this is the right ventricle and this one is the left ventricle. So here is the anterior interventricular artery and this one is the posterior interventricular artery. So anterior interventricular artery, it is a branch of left coronary artery. It is a branch of left coronary artery. Whereas the posterior interventricular artery, it is a branch of right coronary artery. Mostly it is a branch of right coronary artery if it is right dominant heart. So this, it is right ventricle, it supplies the right ventricle except this area. This part is supplied by the left coronary artery. And small part of left ventricle adjoining posterior interventricular groove, and it also supplies small part of left. So this is the left ventricle. So adjoining the posterior interventricular groove where the posterior interventricular artery is present, this part till here it is supplied by the right coronary artery. And also because the posterior interventricular artery, it supplies posterior 1/3 of the interventricular septum, whereas anterior 2/3 of the interventricular septum, it is supplied by the anterior interventricular artery. So this anterior interventricular artery supplies anterior 2/3 of the septum and posterior 1/3 of the septum is supplied by posterior interventricular artery. And proximal part of conducting system. Proximal part of conducting system mainly composed of SA node and AV node, which are usually supplied by the right coronary artery. Let's see the area of distribution of left coronary artery. It supplies the left ventricle and small part of the right ventricle adjoining the atrioventricular groove, just now I have shown, and left atrium, and also anterior superior part, 2/3 of the anterior part of interventricular septum, and the rest of the conducting system, that is the distal part of the conducting system of the heart, which is consists of AV bundle of His and right and left bundle branches. So this is a beautiful diagram showing the blood supply of interventricular septum. So here the blood supply of the interventricular septum, this is one artery which is the anterior interventricular artery, which is also called anterior descending artery, and here is the posterior interventricular artery, which is called posterior descending artery. So the most of the interventricular septum, we can see it is mainly supplied by this part, that is 2/3 by the anterior interventricular artery. So here is the interventricular septum, which is dividing into right and left ventricles. This is the left ventricle and this is the right ventricle of the heart. So anterior interventricular artery is here, which supplies 2/3 of the interventricular septum, and posterior 1/3 of the interventricular septum is supplied by posterior interventricular artery. And the left wall of the left ventricle is supplied by the circumflex artery. So this is the circumflex artery which supplies the left wall of the left ventricle. So that is about the blood supply of interventricular septum. 2/3 of the interventricular septum anterior, 2/3 of the interventricular septum is by the anterior interventricular artery, and posterior 1/3 of the interventricular septum is by the posterior interventricular artery. Posterior interventricular is branch of right coronary artery, whereas that is if it is right dominant heart, and the anterior interventricular is commonly gets origin from left coronary artery. So the left coronary artery gives rise to anterior interventricular branches. So the left ventricle, it is near to the anterior interventricular groove. This part, it is supplied. So here it supplies the right ventricle also partly. So the left ventricle anterior wall is supplied by the anterior interventricular artery. Posterior wall is supplied by the posterior interventricular artery, and the lateral wall is supplied by the circumflex artery. So these are the three arteries supplying the left ventricle. And most importantly, the blood supply to the conducting system of the heart. So 73% the SA nodal artery gains its origin from right coronary artery. So 70% it is by right coronary artery, and rest 23% is by both right and left, and only 3% is by left coronary artery. And AV nodal branches, 80% is by right coronary artery, 10% left, 10% both. And AV bundle, that is the bundle of His, around 70% is supplied by left coronary artery, and both the branches, right and left bundles, which is called the moderator band, they are supplied by anterior interventricular artery, which is in turn a branch of left coronary artery. So this is the blood supply of conducting system of heart. So collateral circulation of these coronary arteries. So cardiac anastomosis and extracardiac anastomosis, there are two types of collateral circulation. Cardiac anastomosis means the anastomosis between the two right and left coronary arteries. Anatomically, these arteries anastomose, but physiologically, functionally, they act as an end arteries. So usually they anastomose within the myocardium of heart. Then extracardiac anastomosis, coronary arteries anastomose with vasa vasorum of aorta, means the blood vessel supplying the aorta, and vasa vasorum of pulmonary arteries, and they also anastomose with the internal thoracic artery, which supply the thoracic wall, which supply the pericardium of heart, and they also anastomose with the bronchial arteries, which supply the lungs, which also supply the pericardium, that is the parietal pericardium of the heart. And phrenic arteries, they also anastomose with the phrenic arteries. One important clinical aspect is the triple vessel disease, where three arteries involved in the thrombosis formation, that is left anterior descending artery, right coronary artery, circumflex artery. These three arteries are more prone for thrombosis. 50% in left anterior descending artery, right coronary artery 30%, and circumflex artery 15%. So it is important to note down these percentages in triple vessel disease. So let's end up with some MCQs. So occlusion of left anterior descending will lead to the infarction of which area? So I'll give some choices. So posterior part of interventricular septum, anterior wall of left ventricle, lateral part of the heart, and inferior surface of the right ventricle. We know that left anterior descending artery, which is nothing but the left anterior interventricular artery, supplies the anterior wall of left ventricle, and it also supplies the interventricular septum, 2/3 of the anterior part of interventricular septum. So let's see explanation of it. Left anterior descending artery supplies anterior 2/3 of the interventricular septum, lying deep to it, and also adjacent anterior wall of left ventricle. And posterior part of the interventricular septum, we know it is supplied by posterior interventricular artery, where it is a branch of right coronary artery. Left surface of the heart is supplied by the circumflex artery. So the next question is about which are the following are the true statements in regard with the right coronary artery. So it is having a lesser diameter than left coronary artery. Just think about it. Right coronary artery arises from the anterior aortic sinus. Right coronary artery supplies major part of right atrium and right ventricle. Right coronary artery gives rise to circumflex coronary branches, and right coronary artery supplies right branch bundle. So which one among this is true? We shall just have an idea. We know that major part of myocardium is supplied by the left coronary artery. So then obviously the diameter should be less. So this is a true statement. Then right coronary artery arises from the anterior aortic sinus. We know that is true. And it supplies major part of right atrium and right ventricle. Circumflex artery is a branch of left coronary artery. So this is a false statement. Then right coronary artery supplies right branch bundle. We know right branch bundle is mainly supplied by the left coronary artery. That is the anterior interventricular branch of left coronary artery. So this also false statement. So this is about the explanation. So thank you for patient listening. Bye.